Good evening, I'm Alicia Stetler, social work student with the University of Houston, and thank you for the opportunity to discuss the opioid epidemic, specifically the high number of overdose deaths caused by intentional exposure to opiates in the state of Illinois. The Illinois Department of Public Health has provided data showing that the number of deaths resulting from opiate overdose has risen from 1,072 in 2013 to 1,946 in 2016. Measures have been taken in the state of Illinois to address this issue. According to Susan Lafferty of the Chicago Tribune, a heroin crisis task force was created in the Illinois House of Representatives in March 2014. And on September 9, 2015, Public Act 990480, also known as the Heroin Crisis Act, was signed into law, which was a result of the work of this task force. The main components of the bill, as reported by the Chicago Tribune, include the increased availability of naloxone, the overdose reversal drug, by requiring training of pharmacists, police, fire, first responders, and school personnel in its administration. Upgrades were also made to the prescription monitoring program to prevent overprescribing of opiate drugs. Changes were made to the state Medicaid program, allowing opiate-related treatments to be covered by Medicaid. Amendments were made to the drug court programs to keep users in treatment and out of jail, and drug education programs were provided in schools. The bill had many strengths. One thing it got right was increasing access to medical-assisted treatments by requiring Medicaid to pay for them. According to David Schaefer of the National Public Radio website, nearly 80% of people experiencing opiate dependency would be covered by Medicaid coverage. Evidence provided by the 2015 study by Roosevelt University showed that over time the state of Illinois would save as much as $12 for every $1 spent on medical-assisted treatments when the costs of the criminal justice and healthcare systems are considered. Another strength is the availability and training of naloxone, the overdose reversal drug. Again, according to the Roosevelt University study, when naloxone is distributed in communities, it can reduce deaths by opiate overdose by up to 50%. And one kit costs between $20 to $40, whereas an overdose death can cost taxpayers up to $40,000. Weaknesses have also been identified to the bill. According to Jonathan Hedinger, reporter at the News-Gazette in Champaign, Drug Court Judge Jeffrey Ford expressed concerns about the overburden that the new eligibility regulations would place on existing drug courts, as there are only 68 drug courts statewide, and that's not enough capacity to meet the demands of the new eligibility guidelines. The Heroin Crisis Act also created several updates to the prescription monitoring system. However, according to Casey Bishel with the Belleville News, there is no requirement in the Heroin Crisis Act or any other legislation that actually requires prescribers to participate in the monitoring program. So, in 2015, out of 46,104 Illinois prescribers of controlled substances, only 16,049 actually registered and used the monitoring program, again according to Belleville News. Based on these weaknesses, I'd like to discuss recommendations to strengthen the Heroin Crisis Act. In response to the drug court concerns reported by the News-Gazette, one recommendation is to increase the capacity of current drug courts by providing additional funding or staffing to create teleconferencing capabilities or mobile drug courts to reach lesser populated areas of the state so that everyone will have access to the treatment opportunities outlined in the Heroin Crisis Act. In response to the concerns about the prescription monitoring program outlined in the Belleville News article, a change in legislation requiring any medical provider authorized to prescribe controlled substances to participate in the prescription monitoring program is recommended in order to truly monitor the prescription pattern of opiate drugs. Thank you for your attention to this matter, and I look forward to further discussion in ways to improve the Heroin Crisis Act and decrease the number of deaths by opiate drug overdose in Illinois.